Welcome back to the Healthy Shift Worker podcast. I'm your host, Audra Starkey. Today's episode, I've got the lovely Dr. Kelsey Dexter on as a guest today, who is an endocrinologist and herbalist dedicated to transforming lives through a unique approach that blends modern medical science with the principles of vitalism. With a focus on improving hormonal and overall health, Dr. Dexter employs a circadian and metabolic wellness framework that addresses the root causes of various health issues. With 9 years of clinical practice, Dr. Dexter has honed her expertise in managing a wide range of conditions, including diabetes, reproductive disorders, thyroid, adrenal and pituitary disorders, as well as obesity and metabolic issues. Her practice is currently based in both Jackson and Nashville, Tennessee. A passionate advocate for holistic health, Dr. Dexter's journey is also personal. She successfully healed herself from multiple sclerosis using a regime of sunlight exposure, fasting, and ketosis. This experience deepened her understanding of the body's innate ability to heal and reinforced her commitment to integrative health practices. I really hope you enjoyed this episode. It was such a pleasure talking to Kelsey. Hi, everyone. Welcome back to today's podcast. I've got a very special guest today is Dr. Kelsey Dexter. She is joining us all the way from Jackson in Tennessee in the USA. So welcome, Dr. Dexter.
Thank you. I'm very happy to be here. Happy to have these conversations.
Yeah, I'm really looking forward to our discussion, being able to talk to an endocrinologist because, as I'm sure you can appreciate, shift workers' hormones go all over the place when we work our crazy and irregular hours. So it's going to be a terrific conversation. So thank you so much for joining me. Now, before I get into the nitty-gritty questions, I'd love to hear about your own personal journey, Kelsey. Like, what led you to eventually becoming so involved in hormonal health and metabolic health?
Good question. So I went to medical school initially to be a dermatologist, which is kind of funny to me now because I was very attuned to skin cancer risk and those types of things. Okay. But when I got into medical school, I sort of recognized that the prevalent issues that Americans were facing and really worldwide, what people were facing as far as chronic disease risk had to do with metabolic issues. And I was more interested in the impact I could have in that arena. So I did a residency in internal medicine, and then I did a fellowship in endocrinology because I was interested specifically in metabolism. And I've always also been drawn to integrative healthcare. So I did several rotations in integrative health centers when I was a resident. But at the time I trained, it was like a little bit too difficult to do formal training. You had to pay to do that. So I tried to figure out an avenue I could go down where I could learn more about this and work with the patient population I wanted to. And when I was in fellowship, I worked in the School of Public Health on projects looking at, it's funny now to think back, but community gardening and new gardeners. And as people started a gardening season, how their health parameters changed. And, we were monitoring BMI and blood pressure and blood sugar and activity and those kinds of things. But I think back now at what we were really measuring was sunshine, grounding, fresh access to fresh local foods, right? So I've always sort of leaned this way, thinking about how environment impacts our overall health. And so after fellowship, I worked in Nashville, North Carolina at a practice for a while, then moved to Jackson, Tennessee. I'm from here, so that's what brought me back here. But we have a huge issue with metabolic disease here and an awful type 2 diabetes and insulin resistance that would blow your mind.
Really?
Okay. Yeah. I mean, I have patients that weigh, 500-600 pounds, are on hundreds of units of insulin a day, just very severe metabolic issues. Currently I work in a busy outpatient practice, and between me and my partners, we manage about 3,500 people, their health. So wow. I see many patients, many shift workers, in my practice.
Mm-hmm.
So I have noted some things about this particular demographic over the years, but I have a very strong interest in circadian health because of all that I've learned over the last few years about how the sun and sunlight impacts our physiology. And I really believe that in modern society, this is probably the most underappreciated and yet most important factor in optimizing health and vitality. Yeah.
Yeah. That's interesting that, yeah, you've made that comment, because I've always wondered, as I've sort of gone down the path of learning more about sleep and circadian health and circadian biology. And I scratch my head now, Kelsey, as to why this is not one of the first topic of conversations in a physician or general practitioner's discussion with a patient. Because it's not, is it? Like, it's not even the second, third, fourth, or fifth. It's just not spoken about at all. But it's such a big integral influence on someone's health.
It definitely is. And I'm not really sure why it's not a larger focus, but it takes time in an office visit, right, to talk to someone about their habits.
Yeah.
And I think that unless you have a practitioner who is really invested in the overall well-being and the big picture, they're going to be focused on the acute complaint, right?
Yeah.
And unfortunately, our modern healthcare system is not set up to allow the kind of discourse that needs to happen and the kind of coaching that needs to happen. And I don't think that circadian health to the general population is an important concept. Like, this has not pervaded general knowledge yet. This is just based on my conversations with patients too. And I ask every patient how they're sleeping, what hours they sleep, how many times they wake up a night, about their light exposure, etc. And many don't even care to discuss that with me, right? Because if I say that, your weight gain and your prediabetes are likely because of artificial light at night and the fact that you sleep from 1 a.m. to noon every day, changing behaviors like that can be challenging, and patients can be resistant to that. So something to keep in mind, though, is the patients that I'm generally taking care of currently have been referred to me by another provider because of these endpoints that are off, right, on labs. So they either have diabetes or they have severe insulin resistance or something. So the patient themselves often didn't make the appointment. So when they come in, they're looking for an easy solution and they're not invested. And I'm trying to get them motivated and invested in their own health and empower individual patients to know that there is so much that we can do to optimize our own health and vitality by changing our environment. And part of our environment is our diet, right? The signal inputs that come in. But I personally think that adjusting light environment and working on sleep cycles is a lot easier than changing diet dramatically. You just have to be consistent with the behaviors to see these endpoints change. And modern life is so inundated with artificial light that it takes some dedication and planning to protect yourself in that regard. Yeah. That's a great segue to a question that I really wanted to dive into, Kelsey, is that correlation that you just mentioned about artificial light and weight gain. Can you please explain to our listeners the mechanisms of how that's happening? Obviously, our listeners, because of their work schedules, they can be up in the middle of the night, unfortunately, with what they do. But I think it's important that you are able to, and as you beautifully do, trying to inspire your change in your patients. Can you explain some of the mechanisms? Because it, as you said, it's not spoken about anywhere. I will explain to my understanding. Yes. Cortisol, our stress hormone, has a very tight secretion pattern that is tied to circadian rhythm. So it's one of the I think all hormones have a circadian signal, but cortisol maybe more so than most. And whenever we dysregulate our sleep cycle and we dysregulate cortisol, it impairs our insulin sensitivity. And we can see this, if you take a steroid, okay, blood sugars rise, and we know that. So whether that's coming from the outside in an exogenous form or inside the body, when you raise blood sugars over time, insulin levels rise to meet that blood sugar rise. And so get this inherent insulin resistance from dysregulated cortisol. So that's one mechanism. Another is that artificial blue light. So that's the solitary wavelength that we get mostly from our screens and our LED bulbs, modern lighting, which has been a big shift in the last 15 years. It activates a hormone in the brain called POMC. And whenever we get blue light in the absence of red light, there is more impact on rise in ACTH, cortisol. It's sort of the same pathway as cortisol dysregulation, but it happens by direct stimulation of POMC. So there's also an insulin secretagogue, meaning a hormone called CLIP that causes insulin to be directly released from the pancreas. So insulin is a hormone. It's an anabolic steroid that causes the body to grow, right? It increases fat stores. It takes glucose and moves it into storage. It can also increase muscle growth, but it's an anabolic steroid. So ideally, our insulin level should be low at night when we're sleeping. And that helps the body get into repair mechanisms, and it helps us utilize our stored energy. So if insulin level stays high, the body can really only utilize glucose for fuel. It can't utilize fat for fuel. And over time, when you have blue light exposure, whenever insulin levels should be low and we should be experiencing darkness, it creates a resistance to the insulin signal and then high cortisol. And both of those hormonal shifts can dramatically impair metabolism and metabolic health.
Yeah, it's amazing, isn't it? Like that's it sounds very complicated, and I know that you've broken it down beautifully for us. That such a something that we're not eating can actually have such an impact on our metabolic health is amazing. I guess just to take a step back a bit, Kelsey, are you able to just explain to our listeners, because not everyone has necessarily a science background, can you explain exactly what is metabolic health and why is it so critically important that we implement strategies to help to improve our metabolic health?
So I think about metabolic health as metabolic flexibility, okay? The ability for our body to utilize different fuel sources when it's appropriate. And when a person has a high degree of metabolic flexibility, when they're fasting, they're using stored energy, and we store the first place we store backup energy is in our liver, in the form of glycogen. We also store glycogen in our muscles. Whenever we fast, for instance, overnight, if we're without food for, sometimes it depends on what your previous meal, but when we fast overnight, we generally get glucose from our glycogen reserves. And if we deplete those overnight, the next day, when we have carbohydrate intake, that's the first place that it gets restored instead of in fat stores, right? So I think that's one component, is that we don't, so a person will actually utilize their glycogen stores on most days, right, when they're fasting. That allows the body by the morning, when the glycogen from the liver is gone, to dip into ketosis or fat metabolism and use some stored energy, and that keeps the body in energy balance. And when the body is easily able to flip that switch between using carbs for fuel and fat for fuel, that's being metabolically flexible. There are lots of advantages to dipping in and out of fat metabolism in regard to energy state. So we know that, when we burn ketones for fuel versus carbohydrates for fuel, we have about 4 times more ATP. coming from the mitochondria. So that's what our body, I kind of think about that as a primary energy source for the body. So fat metabolism is a high energy state. And we also engage in autophagy and mitophagy, which are the process of getting rid of old damaged cells, cellular debris, cleaning up old sluggish mitochondria. And over time, when that happens on a regular basis, we improve health outcomes because we decrease our risk of chronic disease, cancer, atherosclerosis. All these things are related to the cleanup process, right? Yeah.
And so what are the sort of presenting symptoms or pathologies that you're seeing within your patients that obviously clearly identify as metabolic dysfunction? And maybe you can, if you can sort of think of some shift workers amongst that.
So in general, if I have a patient that comes in and says, I'm very low energy and I can't lose weight, and I know that they are actively making some behavior changes through diet and exercise to try to get healthier and are struggling, that they likely have metabolic issues.
Yeah.
But you can identify patients with metabolic syndrome based on high triglycerides and low HDL and high waist circumference and insulin resistance and these commonly reported categories, health parameters. But I generally, when I see patients, they have already been diagnosed with some kind of metabolic issue like prediabetes or type 2 diabetes.
Yeah.
I do see a lot of patients who have hypothyroidism and obesity also who come in and say, I think I can't lose weight because it's my thyroid, right? But their thyroid levels may be perfect. And in the background, they have metabolic dysfunction, leptin resistant, insulin resistance, and they are kind of stuck in glucose metabolism and can't get into fat metabolism. Yeah.
Yeah. So now, a word that you just dropped then was leptin resistance. Now, again, that's not something that is really spoken about. Insulin resistant, yes. Could you explain what exactly is leptin resistance and where that fits in the whole picture?
So first of all, adipose tissue is an endocrine organ, right? It actually makes hormones. And leptin is a hormone that is produced by fat tissue in the body to let the brain know how much energy reserve we have on board. So it's a way that our central processing center gets a read on how much energy we can burn or store based on our reserve. And whenever you carry a lot of excess adipose over time and leptin signaling is high for long periods of time, the receptors in the brain become desensitized to that signal. And so the brain no longer recognizes that the body has fat stores to burn, and it perceives a low energy state. And that has a lot of downstream implications for metabolism. So it thyroid hormone conversion and production. So even if levels of thyroid hormone look normal, the body may be taking active thyroid hormone and inactivating it to downregulate metabolism. So that high reverse T3 is something that you can see sometimes in leptin resistance. It impacts fertility, especially for females. Okay, so if the body perceives a low energy state, it may not be suitable to maintain a pregnancy, right? And one of the things, the first systems that gets impacted in relative like malnutrition or low energy states is the reproductive hormone system. And then our actual metabolic rate can fall if we are leptin resistant to accommodate that low energy state, which means that it's a lot harder to utilize energy stores, and the body's sort of programmed to store energy instead of burn energy freely. Leptin has a relationship with cortisol too. So when cortisol is dysregulated, it tends to promote leptin resistance. And leptin and cortisol both have a strong response to light and light environment. And so the same things that help regulate cortisol can help regulate leptins and make you more leptin sensitive. And in general, there's a huge circadian component to that. So, our meal timing and light that we're exposed to different times of the day are zeitgebers, timekeepers for our hormones. And whenever you have leptin or insulin resistance or cortisol dysregulation, optimizing those signals is really important. So I think about this a lot as it relates to shift workers, because we have to figure out how to give the body some of these signals that are normal signals for human physiology to try to support the system as best we can, even though it's not an optimal situation, right?
Yeah. And I think it's hard to sort of have these conversations with patients or clients, isn't it? Because they sort of think light, how can that actually help me? But it's the type of light and the misappropriately timed light that's causing a lot of the havoc, isn't it? And we can even talk beyond those that aren't officially shift workers, because a lot of people are shift workers because of the choices that they're making, isn't it?
Yeah. I find that there is a little bit of a tough buy-in with patients when I try to discuss this with them, because they think, how could something so simple make such a big impact? But what force in the universe, in our universe, is more powerful than sunlight, right? Like, we know that if we have too much sunlight, if we're not acclimated to the sun, that it can harm us, right? It is powerful. And light signaling is incredibly important as an environmental signal. If we were all living as we evolved to live, in contact with the earth and under the sun, all of these signals would create a harmonious symphony with all of our body processes. And when you start to change the external signals, chaos ensues, basically.
It's a fascinating conversation, and certainly, pardon the pun, been shed more light to me in the last 12 months, in particular, from a sunlight perspective. Now, I know that we've sort of touched on, obviously, the metabolic health, and there is something called metabolic syndrome, which you did already talk a little bit about, the the factors, the triglycerides and the waistline and so forth. I remember I did send a research paper through to you and by Professor Paul Zimmert, and it was called the Circadian syndrome, because we hear about metabolic syndrome, and he titled this the Circadian syndrome, where he's trying to obviously mesh the two. Love your thoughts on that paper, Kelsey.
So I had never seen this paper before, and I'm really thankful that you gave me the opportunity to look over it. So the criticism with the definition of metabolic syndrome is that we've never been able to find a unifying factor that causes all of these independent changes, right? And there are theories about it, like what is the first thing that happens, and are they sort of snowballing on each other? But he is proposing that all of these changes that we define as metabolic syndrome have a common cause, which is circadian dysregulation. And I could not agree more. I really feel like it's circadian dysregulation and our light environment in particular, and light signaling could definitely link all of this pathology together. It would be an amazing experiment for a large population to really try to sync circadian health to see what could happen, right? But this is the main message that I'm trying to spread, that circadian health is a very personal endeavor, right? Nobody can change your habits but you. And so I really want all patients, all people, to be empowered to know that these kinds of shifts can change your life. And not just by preventing chronic disease, but by making you feel superhuman, right? Like
Mm.
it's not normal to be tired and overweight, and it's not normal to feel crappy all the time. And
Mm.
so, like, this is a common narrative in our culture. I hear people say, I'm just getting older and this is what happens. But that's not normal. It's just common. And we
Yeah,
all can do better and we
exactly.
all
Yeah.
can feel better. Um, and that's what I want for the
Mm.
population,
Mm.
for humanity. Yeah.
Mm. Yeah, absolutely. The fatigue, though, and the weight gain, that type of thing, obviously is unfortunately very common amongst the shift working world for obvious reasons, having to get up as at stupid o'clock, as I tend to mention, for some of the shifts, and that certainly makes it more challenging. But again, there are things that they can do, as I discuss with my clients, and even Dr. Max Skolhound, as you know, when I interviewed him on his podcast, he was trying to talk about night shift strategies to help kind of mitigate some of the negative effects. Can you sort of share offhand maybe some of the recommendations that you're sort of talking through to your own shift working clients, Kelsey, to help with this? Because it does, unfortunately, pose a little bit of an extra few challenges to the whole circadian health equation.
Of course. Yeah. So I think that it's important to try to keep the behaviors that are zeitgebers, right,
Mm-hmm.
are timekeepers, as close to normal and optimal as you can, aside
Yep.
from the obvious sleep disturbance, right?
Yep.
So,
Yep.
or schedule issue. So I try to talk patients into eating a bigger meal before the shift
Mm-hmm.
and not eating during the time that they would have been asleep if they can. And if they have to, eat something very low carb
Mm-hmm.
to keep from further spiking insulin and
Yep.
keeping blood sugar stable.
Yep.
And then I ask patients to wear blue light blocking glasses
Mm-hmm.
to mitigate some of this light exposure. And anyone
Mm.
that works in an office in the daytime too, if you're staring at a screen, if you are under artificial light all day, you should be screening out some of that fake light, I believe.
Yeah.
So that
Yeah.
actually applies to everyone.
Yeah.
But I also, if possible, it's really nice for those patients to have a high protein breakfast
Mm-hmm.
around the time the sun comes up. So,
Yeah.
because that's one of the most important timekeepers for our GI health.
Yeah.
And and it also feeds back to leptin and
Mm.
leptin sensitivity when we get a protein load first thing in the morning.
Mm.
So, seeing as much natural light as possible during the day is a good idea too, but patients have to sleep. So, figuring out a way to get some sunlight and get skin in the
Mm.
sun at some
Mm.
point when it's appropriate to make sure that you're making some vitamin D. I
Yeah.
have to say, like every
Mm.
shift worker that I take care of has pretty profound vitamin D deficiency because they just
Mm.
don't see the sun very much during the day. And
Yeah.
we need solar exposure for multiple aspects of health, but I
Mm.
think it's important to kind of come up with a routine where you can get some sun
Mm.
in the daylight hours sometime. And
Mm.
on days off to prioritize that
Yeah.
too. Yeah.
Yeah.
I'm
Wholeheartedly
just
agree.
curious.
Yeah. Yeah.
Is there anything else that you tell patients that I can relay that I missed?
Yeah, no, same, exactly the same. And some of the things that I like to say, because some clients, and I mean, I used to work these sort of shifts myself. I'd start at 3 or 4 o'clock in the morning, which is pretty ruthless. But a lot of, because we weren't really taught what to do, we sort of think, oh, when that alarm clock goes off, we need to eat something to kind of help us get through the shift. But at 3 and 4 o'clock in the morning, it's still nighttime and our body is still asleep. Sort of trying to minimize eating while our digestive system is sleeping is a little bit of a tagline that I try and to share with people. And yeah, so I tend to just recommend having a hot glass of water, and going into work, still not eating. And again, it is tricky because depending on your job, we don't get exactly the ideal meal breaks at sunrise. So it's just doing what you possibly can. So yeah, holding out, not eating until the sun comes up, and if possible, ducking outside for 5 minutes to at least get some kind of sunlight, natural light exposure to let your body know that this is the correct time, even though you've been up since 3. This is really the time at 6 or 7 o'clock, and then having something to eat pretty much soon after, because as you say, that it's a Zeitgeber. The light is also the Zeitgeber, but so is food, and that helps to sort of set off that cascade. But I really liked, Kelsey, that you did articulate at the end of the day, even though we are working crazy and irregular hours, we need to be doing as much as we possibly can to get back into always resetting and recalibrating our circadian rhythms so that we don't live in this sort of circadian mismatch. So that's kind of kind rule of thumb, which is clearly what you're doing anyway. But it does come down to the specifics of shifts and so forth. But on that note, actually, I remember having some clients that were night shifters, like they would do weeks and weeks of just night shift. And I found that they even were on their days off working, pretending that they were night shift. So they would sleep during the day on their days off and get up at 2 or 3 o'clock in the morning, which I was going, kind of thing. What are your thoughts on that from a night shift perspective?
Well, I do think that it's important to get as much normal rhythm, like physiologic rhythm, as possible. I think a lot of people who work night shift routinely think that if they stay in the same groove and the same pattern, it'll be easier to stay up at night and they won't get as tired. But there are so many health benefits to going back to normal when you can.
Exactly.
So it's maybe harder, but it's worth it for the long-term disease prevention, right?
Because we're not owls. We might be
That's
trying
right.
to,
We're not.
but we're not owls. So my other question was, I suppose, have you got any other thoughts because at the moment there's a big push, particularly when it comes to diabetes medication and weight loss medication, things like Ozempic and so forth. I'd love your thoughts on those particular medications. Are they safe? Are they effective? Are they something that people should be doing in the long term? Yeah. What are your thoughts?
So I think that this depends on the individual and their situation. But when I see patients, my goal is to accomplish health with as few pharmaceuticals as possible. That's just my general strategy. But that's not always possible for each individual. And I like to give every patient choices, you know? So when it comes to weight loss medications, these GLP-1 agonists are the most potent weight loss medicines that have ever been utilized in modern care. And for most people, they can be an aid to lose weight, but it's not a sustainable solution for long-term health. And there are risks and benefits with every intervention that we choose. So GLP-1 agonists do slow down the GI tract. I have had several patients who have had horrible pancreatitis and lots that have had severe constipation and many that have had nausea and vomiting on these, and not everyone can tolerate them. That being said, I in my centralized practice where patients come to me for diabetes help, right? If I have someone who is very clearly overweight and it's taking a lot of insulin to control their blood sugar, I would rather put them on a non-insulin medicine that sensitizes them to their own insulin and be able to take them off of insulin, because insulin is an anabolic steroid, like I said, and it promotes weight gain. So once patients get in this pattern of insulin resistance where they're utilizing more and more and more insulin, it just makes their metabolic health worse over time, even as their blood sugars come down. So I like to use GLP-1 agonists as adjunctive therapy to try to get patients off of other medicines. And if we can get patients losing weight, we can decrease their medication over time. And I've taken many patients off of high doses of insulin and then weaned their GLP-1 agonist. So I think like anything else, it's a tool, but it shouldn't be the default answer for weight loss, because our weight issues collectively, the majority of people in the Western world are overweight. Yeah. And so like there's a systemic problem. There's an environmental problem. There's so we have to address that as a collective, and we can't just put everybody on these medicines to lose weight. Yeah.
Yeah, and they're not really teaching people to eat well, are they? They're not teaching people how to improve their lifestyle. It's just getting a little bit of an outcome. But yeah.
That's right. And I actually find that patients who are on these medicines, because their appetite tends to be pretty suppressed, they really don't nourish their bodies well at all. And the things that they choose to eat are kind of like, this is just, I'm generalizing here, okay?
Yeah.
But are kind of like carby, snacky things during the day.
Yeah.
And they really don't get enough protein. They don't get enough healthy fats.
Yeah.
Aren't eating fresh fruits and vegetables. And as the weight loss occurs, muscle loss also happens. And I can see like them patients just kind of withering away. If I see this, I have to stop it, right? But almost if patients are taking these medications and losing a lot of weight, they are definitely losing muscle too, unless they are supporting, they're actively trying to develop muscles with weight-bearing exercise and higher protein intake. And I just don't see that as being very common. So I've had several patients where I used this medication for diabetes management, and I saw them losing muscle mass who got very weak over time, and we had to come off of the medication. So I also see sometimes enormous hair loss in these patients that lose a lot of weight, because the body is effectively, it perceives a starvation state. And so it downregulates importance of anything that is not necessary for survival, and it just lets go of that hair, And patients come in and say, I think something's wrong with my thyroid. All my hair is falling out. And I say, well, no, you just lost 40 pounds in a few months, and your body is screaming for nutrients.
In shock.
Basically, in shock, Yeah. So I think there's a lot of nuance when it comes to how we utilize this class of medication, but the least amount of medication is usually the best long-term option if it's possible for patients, and that depends on their own level of motivation for behavior change typically.
Yeah, I guess if it gets the ball rolling for people that are particularly overweight, then it gives them a little bit of confidence back. But as you said, it's just as a aid to be used amongst everything else. So that just brings me to, I just had a thought about then too. No doubt that you've worked or working with patients that have maybe had gastric bypass surgery or a gastric sleeve. What's the kind of protocol that you do working with those clients to get them back to a long-term health? Yeah, it's sustainable in the long term, having to manage that after the surgery.
A bias regarding this, just because I end up seeing patients who have had bypass surgery that have nutrient malabsorption. So I often manage like chronic low calcium, low copper, B12 deficiency, these kinds of things that manifest. So I'm often talking to patients about nutrient density in their foods, and we're trying to get as much micronutrient density as we can. I coach pretty much everybody to prioritize protein, because I think in general we undereat it collectively, and that helps. There's so much nutrient density in meat. Backstory, I was a plant-based vegetarian for 15 years. And there are periods of my life when I was a vegetarian, when I could maintain health like that, but I got very sick when I was a vegetarian, and increasing my protein intake was part of my journey back to vitality. And so I think about this a lot in patients who generally are sort of in a long-term catabolic or breakdown state where they're losing a lot of weight actively, which sometimes happens right after bypass surgery. It's sort of the same issues that can happen if you're utilizing medication to do that, with the complication of potential micronutrient malabsorption. So I check different vitamin levels routinely on patients who've had bypass surgery, and we try to do the best to keep those in normal range, you know. But,
yeah, good. I mean, I think it's important that you even bring that to attention. I don't know if that's a discussion that is even before surgery that happens between the doctor and patient, to let them know that that's likely going to happen.
And it's not every patient, right? But it's common enough that it's a standard recommended protocol for monitoring. I've also had patients who were very insulin resistant before they had surgery, and insulin comes from beta cells in the pancreas, and they hypertrophy whenever they're under constant stimulation. And then whenever post-operatively, blood sugars would be really low because the insulin levels still hadn't resensitized, and we call that nocidioblastosis, where like patients are fighting this high insulin level and low blood sugars all the time. And since nutrients aren't absorbed as well when you have gastric bypass, it's harder to keep blood sugars up. So I've seen some pretty challenging cases over the years, and that's not the average person, but it's a possibility, and I think everybody should know about that before they consider something as aggressive as bypass surgery.
And as permanent. Just wanted to bypass back to the thyroid, Kelsey, if you don't mind, because I know that it's such a big topic, and I don't know how lab tests are managed sort of in the US. Obviously, it can be different here over there than it is in Australia. But generally, when people go to a general practitioner, they'll just order, the GP might, somebody's presenting with fatigue, they'll just order the TSH, so the thyroid stimulating hormone, and then that comes back as normal, and the GP says everything's fine. Can you please... your thoughts. I'll just leave it at that.
So thyroid pathology can really present in sort of three different ways, in my view. Okay, so you can have overt thyroid hormone dysregulation, right, where the TSH is abnormal, and we know you're either hyper or hypothyroid clinically. And in that case, supplementing thyroid hormone or giving an anti-thyroid medication to calm down the thyroid are appropriate. But that's the toolbox. And this is the toolbox of Western medicine, these two types of medicine, right? Thyroid hormone, anti-thyroid medicine. So then outside of that, the most common cause of hypothyroidism, far and away, is autoimmune thyroid disease, Hashimoto's thyroiditis, Hashimoto's. So that is identified by antibody testing. And you can have thyroid inflammation from autoimmune disease years before TSH ever becomes abnormal. And in some patients with Hashimoto's, it may never become abnormal. But if your major metabolic regulator, right, this organ is inflamed, you're going to have some symptoms related to that, right? Like, I don't know that anyone could really feel healthy and energetic with an inflamed thyroid gland, even when the thyroid levels are fine. So in every patient that I see that complains of fatigue, we check thyroid antibodies and I screen for this. The issue is that there aren't, like Western medicine doesn't have a great toolbox for dealing with Hashimoto's, but there have been studies that show that certain supplement combinations can lower antibody results over time. Nervous system regulation, very important when you're dealing with any kind of autoimmune condition. And there are also some studies looking at photobiomodulation, red light therapy, and its
Yes.
impact on thyroid
Yep.
inflammation.
Yep.
So I'm actually testing this in a patient right now who's trying to reverse her Hashimoto's. So we're doing a red light therapy protocol. She's already
Excellent.
very attuned to like low carb, nutrient dense diet and circadian regulation. She's doing everything else. So we're adding
Right.
this red light component in. So I'm
Yeah.
excited to talk about this later when we have some data to review.
Yeah.
But if we see data that shows that red light therapy, red and infrared light, can actually improve thyroid inflammation, doesn't it make sense that getting into sunshine, which is 42% red and infrared light, would have a pretty big impact on that overall? And we know that circadian regulation also impacts immune function and can calm
Yep.
down the immune system and keep it from being overactive. Vitamin D has a direct relationship to immune regulation as well. So I think there are many things that can happen to help heal an inflamed thyroid that have nothing to do with medication, right?
Yeah.
The third thing is that we can have relative thyroid dysregulation because of leptin resistance and the body's like turn down of the metabolism overall. So a lot of times that manifests, we can see that like a high reverse T3. So
Yep.
whenever thyroid hormone is produced, the thyroid gland mainly makes T4, which is an inactive form of thyroid hormone, with a little bit of direct T3, and the ratio is about 12-1. And so most active thyroid hormone that we have in our body is we get by conversion in peripheral tissue, so it moves from T4 to T3. After our body has made T3, it can't go back to T4. So instead, to deactivate the T3, the body changes it to reverse T3. When thyroid hormone, like thyroid health is really robust and metabolism is robust, reverse T3 would be pretty low because the body's not having to shunt active hormone into inactive state. So if you see this inactivated form of T3, it could be because the body is under duress in some way or because of insulin resistance. So we could see this in people who are chronically ill too, where the body's trying to conserve energy, right? And then the reverse T3 will be high. And the TSH and free T4 and T3 may all be normal, but the reverse T3 is high. So it's just a sign of that the thyroid's kind of being turned down by the body, so to speak.
Struggling. Yeah. So good recommendation is to see a practitioner that will potentially recommend ordering the whole thyroid panel to have a better view. Yeah. Of a good of what's going on.
That's my personal strategy, right? And not everybody agrees with me in the endocrinology world on that. So, but
of course.
I take care of a lot of people who have autoimmune thyroid disease, and we've seen some big improvements using some of these strategies. So I think it's important to screen for it.
Yeah. And it's just knowing the importance of light and how it can, just by getting outdoors where humanly possible on more regular basis, can help with our thyroid is I think I'd love to sort of scream it from the rooftops. Because we hear a lot about, but in order to boost the metabolism, we must be eating 3, 4, 5, 6 meals a day. I remember hearing that going,
no, don't do that.
Yeah, exactly. So I know how I would describe that with my clients, but when you hear that, Kelsey, obviously with your reaction, why is that not such a good idea?
Well, every time you eat, especially if you have carbohydrate, you stimulate insulin secretion. And insulin keeps you in an anabolic or growth state. It keeps you out of a fat burn and repair state. So it's really helpful to let your insulin level fall between meals so that you can dip in and out of glucose and fat metabolism but stay insulin sensitive. The more often that insulin is triggered, the more resistant you'll get to the signal over time. So I am a big fan of timed eating intervals, intermittent fasting, avoiding snacking. But we know that people who eat within 3 hours of bedtime are at a much higher risk of getting metabolic dysfunction and diabetes. And so
From the
really,
biological night perspective, sorry to interrupt, Kelsey, when you're saying 3 hours before eating, you're referring to
oh, yes,
under
it's
normal
biological night.
circumstance.
Yes,
Yeah.
under
Yep.
normal circumstances, yes. So
Yeah.
3 hours of nighttime bedtime.
Mm.
So I really, for most patients, I try to talk them into going 12 hours at some point in the day without consuming anything with calories, right?
Yeah.
Like a timed eating
Yeah.
interval of 12 hours or less.
Mm.
That would be so for people who sleep at night, right, that would be a really physiologic thing to do
Yeah.
to avoid eating. It's basically you don't eat when it's dark outside.
Mm. Mm.
Yeah.
Mm.
As a general rule.
Yeah. Yeah.
And that helps your body utilize stored energy, like I said, and get into repair states while you sleep. But I think it's just part of this story of trying to let the body's insulin levels fall
Yeah.
whenever we can, because
Yeah.
the default state in our current world is that insulin gets triggered a lot, and it's either from blue light or it's from snacking and carbs. So
Yeah.
the more we can attune to that issue
Mm.
and moderate, the healthier we'll be long term. So snacks, if a person has to have snacks, I would definitely say that they should be protein and fat-based snacks that don't stimulate insulin.
Yeah.
Ideally. Yeah.
Yeah. Perfect. I'm glad that you've articulated it in that way. The same. Just I think a couple more questions before we wrap up, Kelsey. Do you have any top 3 recommendations that you would suggest to your clients, sort of dietary, lifestyle changes that can help to improve their metabolic health? Where's a great place to start for people?
My first recommendation is to see the sun. So this may not apply to all shift workers. So
When they
this
can.
is just optimization. When they can. Okay.
When they can.
Just
Yeah.
see morning light, see the sunrise with bare eyes every day possible, because it's the most important circadian signal that we can give our bodies for circadian health.
Yeah.
Focus on protein at mealtime. Don't drink sugar. And eat when the sun is up. Yeah. So that's 4, but those are kind of like probably the most important things that I could think of. Yeah.
Don't drink sugar. I think that's yeah, no, but it's really good. And again, let's sort of break it down simply for people. When you mean don't drink sugar, what exactly are you referring to?
Yeah, I'm sorry. This is my my southern United States bias, okay? Because I see people with a huge Mountain Dew in hand all day long, right? I see them drinking sweet tea with every meal. It's a very common thing in the South. So I battle liquid sugar intake aggressively in my clinic, because there is no stronger stimulus of insulin secretion than liquid sugar, right? Because there's nothing that makes blood sugar rise more quickly. So for someone who has metabolic disease, drinking sugar it should be limited. Limited. And I mean, I'll just say, like, I don't have metabolic issues and I don't drink sugar. So, because I don't want to have metabolic issues, right? I think it's fine to have a little bit of honey in your tea sometimes or something like that, right? And especially if you're going to do something like that, it should be when you have protein and fat already in your belly, to limit like the glucose excursion that happens, the absorption of that sugar. And for someone who has pretty good metabolic health, that kind of thing can be tolerated fine, especially if you're active. But in general, the patients that I see are not, and they are pretty sick. And so that's one of my rules for people who are trying to lose weight or control their blood sugar, is we cut out liquid sugar.
Yeah. Great. Until they become a little bit more metabolically flexible. But in saying that, we're not meant to be drinking at all. We don't pour a can of Coke into our plants. We just give them water, don't we?
No, I use that analogy all the time. I say, so if I watered your houseplant with Dr. Pepper, what would happen to it, right?
Yeah.
It wouldn't do so well. The other thing that's really interesting too, like if a house plant doesn't get UV light, right? If it doesn't get good sunshine and it's not connected to the earth for energy, I mean, no houseplants ever are as vital as plants that are outside, right? And humans have so much in common with plants when it comes to energy capture.
Yeah.
So,
yeah.
Drinking clean, remineralized, structured water. I mean, we could go on a rabbit hole there, but it's really important for human health. So, choosing good hydration strategies is important. Yeah.
That's great, and we should always be thinking of ourselves of a plant, because we wouldn't put a blanket over a plant to stop it from getting the sun, but that's pretty much what we're doing by avoiding the sun, lathering ourselves up with bucket loads of toxic sunscreen. And we wouldn't be, unless it's, I guess, a plant that grows in water, but they like to be in the soil as well. So it kind of gives a clue that we should be doing the same too, isn't it? Without our shoes and
living creatures on the earth are designed to be in contact with the earth and under the sun, right?
Yeah.
That's what's supposed to happen.
Yeah.
And that's where we belong. And when we change that environment, we change our health outcomes.
Yeah.
So,
yeah. Absolutely. Well, before we wrap up, Kelsey, is there any other parting comment that you'd like to add? Is there something that I might have missed that you think would be really beneficial for our listeners to know?
There's nothing that I can think of offhand.
No, we have kind of covered quite a lot, haven't we? Yeah. Actually, I did think of one thing just then. Actually, being sedentary is not great for our metabolic health either. Yeah. So how does movement help with improving our blood sugar regulation and insulin resistance?
So every time a muscle contracts, it uses glucose as long as stored glucose is in the muscle, right?
Yeah.
And when so muscle is like a storage system for excess glucose. So the more muscle that we have, the bigger glucose storage capacity we have. And then the more we use our muscles, the more carbohydrate we can tolerate and still maintain metabolic health.
Yeah.
So building muscle is very important for insulin sensitivity and metabolic health. And then actually using those muscles and using glucose is important.
Yeah.
We know that 10,000 steps a day has really positive health outcomes as far as disease prevention. And I don't think we have to focus on like heavy cardio and hips kinds of things to actually improve our metabolic health. Building muscle and getting moving are the most important things. But yeah, I generally, I try to talk patients into doing resistance type of workouts when they're trying to improve their metabolic health. Yeah. And then there's a study that was done recently that showed that if you do like 45 seconds of air squats every hour during a day, it improves insulin sensitivity pretty dramatically. And so sometimes it's really easy to add these little, bursts of activity just to help your body utilize glucose normally. I use that strategy. So it's movement after you eat. Yep. So taking a walk after you eat, especially if you had a high carb meal, can really help blunt that glucose rise, which can help with weight and insulin sensitivity over time. And so can air squats, right? So you don't even have to leave your house. 45 seconds of air squats.
Wow.
Yeah.
I think that's great. Again, I always think of some of my clients that might be working in call centers or even just office workers that are stuck sitting down all the time. If they get up off their chair and they may not even have to disconnect from their phone kind of thing, they can sort of do it.
Right. Yeah. I'm a big fan of walking pads under desks too, and standing desks, because even when we stand, our core muscles have to engage, and we utilize those muscles, right? Yeah. So just standing is really important if you are stuck behind a desk. Yeah. Bonus points if you can get an under desk peddler, like a cycling I have a few doctor friends who do that while they do notes, right? They like pedal under the desk.
Love it.
And then
Great idea.
I myself, I work with a walking pad, so I walk very slowly while I work at my standing desk. So it's just some strategies. That's all not always possible in your particular work setting. So I do think that having just the motivation to stand up and walk around a little bit and to consider doing some just sort of body weight exercise here and there can be really helpful in the long run.
And where you can, ducking outside, getting that sun.
That's right. That's right. Absolutely.
As well. Yeah. Well, this has been fantastic, Kelsey. Thank you so much for joining me. I know that I've certainly learnt a lot in our chat today, and I'm sure our listeners have. For those that might be based in the States and happen to be living very closely near you, or I'm not sure if you do telehealth consultations, if anybody wanted to get in touch, what's the best way to do that?
So it's a little bit complex right now because things are shifting for me. But in my day-to-day practice, I am pretty inundated. So I'm not taking any new in-person patients in Jackson at the moment, but I am working on an online option for one-on-one consultations. And I also am building an online circadian health platform called Circadian Health Revival with another practitioner, where we're going to be talking about these topics in detail, teaching, question and answer, challenges, group accountability, that kind of thing.
Great.
That's launching on the solstice, so next week, which is great. Yeah.
Fantastic.
I'm also on Instagram. So if you want to contact me through my Instagram profile, it's probably the easiest way to get in touch. Yeah.
Yeah. That's where I stalked you. That's great. Well, I'll make sure that I put those links and everything about with the Instagram and everything on the show notes so that everyone can find you and follow you for those wanting to learn more. But again, thank you so much, Kelsey. It's been an absolute pleasure having you on the podcast. You're one of those humans that I'd love to meet one day in person, and I truly hope that actually does happen. You sound like doing phenomenal work. You're doing amazing work for so many people, so thank you.
Thank you, Audra. It's so nice to have this platform, and I just appreciate the opportunity. And it's so nice to meet you.
Likewise. All right. Thank you so much, everyone, for listening to today's podcast, and I look forward to speaking with you soon.